I've definitely got an interest in women's health. I've done my diploma in obstetrics and gynecology, and at one point thought I wanted to become an obstetrician. But I found that I actually enjoyed the clinics more, and talking to the patients and having that continuity of care was what really drew me to general practice. So I like working with women of all ages, but particularly that sort of pre-pregnancy counselling, and then I do shared care, so I see a lot of pregnant women, which is really lovely, and then go through the postpartum period with them as well and see their babies, and then I also quite enjoy working with sort of menopausal, postmenopausal women, and that's a big sort of life transition stage as well. So yeah, I find all the hormones quite fascinating. Probably my own health journey, particularly after I had my second child. I think conventional medicine probably wouldn't have really had the answers as to why I wasn't feeling great. And so I worked with naturopath and some integrative doctors, and to really get my health back on track through lifestyle changes, particularly dietary changes, and the use of supplements and other things. So yeah, I just found it really interesting. I guess for a long time I've been interested in diet and nutrition. And you're trying to look at the root cause of what's actually going on, rather than just treating the symptoms that patients come in with, and having a more holistic approach. Like, I still think the conventional side of things is a good point to start with, and make sure you're covering those bases, and then to bring in the integrative side of it really complements that, so focusing on the lifestyle changes they can make, and the use of supplements and dietary changes. Patients, sort of empowering patients, I guess, a bit more too, to take control of their health and how they can best do that. I love this clinic, well, just one, because it's really bright and light, and the staff are very happy and they obviously enjoy what they do. I think the patients are, knowing it's a sort of holistic integrative clinic, are much more open, or wanting more lifestyle advice and the use of supplements and things to improve their health, rather than just looking for a quick fix. Having more time, and us being able to take a more thorough history, particularly around diet and exercise and stress, and getting a more clearer picture of what's going on in their life and how that can contribute to their health. I like Michael Pollan's eat food, not too much, mostly plants. I think that's pretty much the best dietary advice you can give people when it all comes back down to it, yeah. To stay healthy, I try to eat well, and I'm pretty active, particularly with running around after two small children. I've recently just started doing some boxing, which is it's quite fun. And I've always sort of been interested in yoga and going for a walk along the foreshore, and try to meditate most days. And I guess I'm passionate about what I do, which helps come to work, and then yeah, making sure I have time to catch up with family and friends is also really important.